Back to our top story now. The NHS has been told to be ready for a Covid-19 jab within weeks, but the Health Secretary says children will not be in line for the vaccine developed by Pfizer and BioNTech because it's only been tested on adults. The elderly and health and social care workers are at the front of the queue for an approved vaccine. But what about rollouts to the rest of the population? Let's bring in Dr. Bharat Pankania, a senior clinical lecturer at the University of Exeter. Doctor, always good to get your thoughts. So we are still waiting for the safety data, but firstly, how optimistic should we be about the arrival of this vaccine?
We should be as optimistic as we should be for the other vaccine manufacturers as well. And there are many questions that we would still like Pfizer and BioNTech to also answer. Remember, when they said 90% protective, I would like further distillation and explanation of their figures, because I want to know, are you sure? Are you really sure? And are you really sure again? Because I don't really think the 90% figure tallies up very well, because it depends on how many people have actually been exposed to the virus after they had been immunized with this trial vaccine, rather than, you see, I could be immunized and sit at home and never get exposed to the virus. So does that mean I'm protected or not protected? So all those fine issues we need to iron out before we can say, we have got a successful vaccine with us.
So at the moment, you're not 100% confident that it is 90% effective?
Absolutely. And it's regrettable that we have these press statements by big, august companies like Pfizer. They're very good companies. But to just say, I have got 90% protection raises a lot of hopes. And we need to get this correct, that are you sure it is 90%, especially in your vulnerable groups?
What do you make plans for the rollout in the UK? Those who are residents in care homes and care home staff will be at the very top of the list.
Yes, that's a good strategy. So we need to immunize the people who will have severe illness should they get infected. And then the second line of people also, and almost not the second, but the same time, is frontline staff. So that would be doctors, nurses, healthcare workers, and people in vulnerable settings like healthcare homes. That is essential. That would be first line. And actually, by the way, the more vulnerable the people, the less immune response that they mount. So it may end up that we give them 2 doses, maybe even 3 doses to prime their immune systems up.
Yeah, the Health Secretary said 2 doses, 20 days apart. It does sound like a Herculean task. Given that this vaccine needs to be stored at a particular temperature, you need to have the necessary machinery in order to be able to store it. It's not going to be an easy job.
It is not an easy job, Gamal. You're absolutely right. And also, whilst we in an affluent country can afford complicated refrigeration equipment, it may not work in poorer countries where you don't have that storage capacity, that minus 80 degrees centigrade that you need. But the good news is, really, and it is good news, is that there are other vaccine manufacturers as well. And I expect them also to be successful. And some of their vaccines don't need complex storage systems. So that's good news for other parts of the world.
One other coronavirus-related story that we're keeping a close eye on is what is going on in Denmark with this new strain of coronavirus found in Danish Mink. How alarmed are you by that occurrence? And also with this vaccine and the newer vaccines that we'll be seeing over the next few weeks and months, will they be able to combat this new coronavirus strain?
Yes, so I'm not too concerned about will we have a vaccine failure because of an evolution of a virus amongst the minks in, for example, Denmark, because what we can do is we can bespoke make vaccines. So the key thing is first make the successful vaccine. Secondly, as the virus mutates and changes as it reproduces, we can make a vaccine to match the circulating strain that there is. But what I am concerned about is that we in the 21st century still wish to farm animals in an intensive manner. We don't seem to want to learn our lessons that if you mess with the environment, bad things can happen. So what I'm worried about with the mink population is if it is then becomes a natural reservoir in the animal kingdom of SARS-CoV-2, it becomes that much more difficult to contain and control in months and years ahead.
I guess that's how we got into this mess in the first place. So, I mean, what should countries be thinking about doing now as we move on, as we move forward into 2021?
Well, protection is the best tool forward, and protection doesn't look sexy enough. But I promise you, Gamal, that if you spend a few £billion on prevention and protection, it is much, much better, and it has to be done internationally. And I'm really pleased to see President Joe Biden-elect saying he's going to re-enter WHO. So I hope with international treaties, we will work on not creating the environment where new viruses emerge. That would be the most best thing we can ever do compared to the trillions we have spent once the virus had arrived and we were fighting fires with it.
Dr. Pankania, always appreciate your expertise. Thank you.
Thank you. Thank you.